I'm Bruce Parsons, Senior Medical Director at Pfizer, and I will, in 2 or 3 minutes, walk you through this presentation, which is a presentation on the time to onset of a reduction in pain-related sleep interference in patients with peripheral neuropathy, either diabetic peripheral neuropathy or postherpetic neuralgia. Now, a previous study demonstrated that the effects of Lyrica on pain manifest themselves within the first 3 days, and that's a publication that was published by Sharma and is referenced on the poster. What we did here was we asked the patient, and this is a question that is common throughout our studies, we asked the patient, how much did your pain interfere with your sleeping last night? And we record that on a daily basis. As you can see, there were many studies that were included in the analysis. Some of the patients were patients in PHN trials. Some of the patients were patients in diabetic peripheral neuropathy trials. And a few trials included patients from both categories. This is the baseline characteristics of who was in our trials, and this is a composite of all of the data that are presented on the poster. And as you can see, the mean age was rather high, which is what you would expect from patients with BPN and PHN. There was a somewhat equal distribution in men and women. The patients entered the study with a mean pain score of approximately 6.5, which meant they were moderately severe. 0 to 10 is the scale, 10 being the most severe. And their sleep interference was somewhat lower, patients in the moderate range, between 4 and 5. As you see here, these are all of the treatment arms by dose. And what this is looking at is the change in sleep interference scores from the time the patient entered the study till the end of the study. And as you can see, most of the arms are significant, which is pregabalin decreased pain-related sleep interference in most of the treatment arms that we analyzed. If you look at some of the treatment arms that were not significant, they tend to cluster at the lower doses, which is not surprising. 75 milligrams is not an approved dose. This was included in their studies so we could establish that 150 milligrams was the minimum effective dose. Of the 24 arms that were significant, 23 of these showed a reduction in pain-related sleep interference within the first 14 days. So the way these data were analyzed is that we had the daily scores. The first time a patient showed a reduction in 2 consecutive days, they were scored as being significant. And as you can see, so if your reduction was day 1 and day 2, that's a day 1 reduction. If it's day 2 and day 3, that's a day 2 reduction. 3 and 4, etc. So of all the arms that showed significance from baseline to endpoint, all but one had a reduction within the first 14 days, and the average was 1.67 days. This arm had a reduction over time, but we didn't see anything happening within the first 14 days of analysis. So in summary, we do find that pregabalin is effective in reducing pain-related sleep interference in patients with BPN and PHN, and these reductions occur on average within the first couple of days of treatment.